Hello and welcome to Generational Wellbeing with Dr. Loam. I am Dr. Loam. Thank you for joining me here today. I am a pediatrician and founder of Generational Wellbeing. I help parents create sustainable healthy habits so that they can reverse chronic disease conditions like obesity and diabetes for themselves and for their kids. So, today I really want to talk about diabetes because one, it is increasing in kids. Since 2020, we're now seeing a lot of children being diagnosed with diabetes. And the problem with that is that when kids are diagnosed with diabetes, their complications are even worse. So imagine if a 15-year-old is diagnosed with diabetes, by the time they're 30 years old, because diabetes affects all the systems of the body, it affects the blood vessels going to different organs, they start experiencing complications like vision because it affects the blood vessels going into the eyes. They can have kidney disease, they can have liver issues, nerve damage and stuff. So it is important then that we understand what it is and start doing what we need to do to make sure our kids don't end up with a diagnosis. Or if you're a parent who has a kid who has been diagnosed with diabetes, there's no fear because there are things we can do to help reverse or make sure that their blood sugars maintain at a low level where they don't end up with those complications. So what is diabetes then? So diabetes is when insulin, which is a hormone in your body, is not functioning well. So what does insulin do? When you eat, especially carbs and stuff, insulin takes the sugars from your bloodstream into the blood cells so that those blood cells can start using it now as energy. Now, if you don't have enough insulin or your blood cells are resistant to the insulin, meaning the hormone is not able to do its work to get that blood sugar out of your blood vessels into the cells, then your sugar levels go high. And that's when you see symptoms of hyperglycemia, when you have a kid who is thirsty all the time, hungry all the time, have dry skin, or some kids, if over time they've had insulin resistant that leads to that hyperglycemic state, you can have that thick, dark skin around the necks and the underarms and stuff. And over time, when you have those high levels, then you start being diagnosed with diabetes, and the blood vessels, again, all of that sugars in your blood vessels are affected, and then it can lead down to organ damage. So what are the causes of diabetes? So there are two main types of diabetes. The first one is the type 1 diabetes. With this one, we see it mostly in kids, usually with people less than 20 years old, and it could be due to genetics, it could be an autoimmune condition that will cause it, or it could be triggered by a viral infection. That's the most common that I've seen recently, where your kid has some kind of a viral infection and then somehow it affects the cells in your pancreas that produce insulin. So then that particular individual is not producing any insulin, so there's no insulin there to get all of that glucose and the sugars out of the bloodstreams into the cells. Then the glucose just sits in the bloodstream, and then you start having all those symptoms we talked about. The second type of diabetes is the type 2 diabetes, which is a more common one, and it's seen in kids now, more so in adults, but now we're seeing it in kids in their teens and in the young adult population. And what are the risk factors for that? Those are the ones where you see the family history of type 2 diabetes, where if we're continuing to do what our parents were doing, we may end up risking to end up with that, or there's overweight, or obesity can be a risk factor for that too. And with this one is because we've had overwhelmingly high sugars in our bloodstream, where eventually our insulin is not functioning properly, so it's not doing a good enough job to get the sugars from the blood vessels or from into the cells to produce the energy, and then we end up with those symptoms. But when we present, you see there's like a different time of onset usually, and the risk factors are a bit different when it comes to that. How do you take care of the kids who have type 2 diabetes? So, or with diabetes in general. So with the kids with type 1 diabetes, because the pancreatic cells, the pancreas is the organ in your body that produces insulin. And because those cells that usually produce insulin have been damaged, or they're not functioning at all, they're not producing insulin. With these kids, they just have to give themselves insulin because there is no insulin anywhere to help get those the sugars out of the bloodstream. As far as type 2 goes, is that you have the insulin, but it's just not functioning properly. There's certain things that can help improve that, whether it's weight loss, or eating the right foods and reducing the sugars in your diet. That's where all the sugar diabetes and all of this comes from. Or it could be even exercise, because exercise has been shown to help your insulin function better, or better than if you were not to have insulin. So today I wanted to just give you this overview about diabetes, what it is, what causes it, and what are the risk factors and the different things. And of course, there's another kind of diabetes where there's some kids who have chronic disease conditions like cystic fibrosis, that just because of how the disease is, it ends up affecting um, the pancreas and other organs, and then these kids eventually end up with diabetes, but based because of the disease process of something else. So I hope you found this video helpful. I started out just to introduce diabetes today. Tomorrow I'll talk about symptoms and management, just to give you an overview of why it happens and what you can do if you have it to start reversing those symptoms. That way you don't end up with complications. And we know complications of diabetes are not benign, they're severe. It's now the number one leading cause of blindness, especially in kids who are diagnosed with diabetes early. And it leads to another symptom I didn't talk about, is poor wound healing. And if you have poor wound healing, we've had a lot of individuals who've ended up with amputations because of wounds that are not healing, and you have to amputate that extremity just to prevent spread of infection. It affects your kidneys too. One of the biggest reasons why a lot of people or individuals end up on dialysis, because of long-term complications, again because it affects all the blood vessels. So it's then important that if you have been diagnosed with diabetes, or you have a kid who's been diagnosed with diabetes, there is hope. There is help. There are things we can do to help reverse this disease condition, or at least reverse it where your blood sugar levels are low, where your blood vessels are not affected severely, and you don't end up with those complications. So stay tuned for the second step of the second part of this video, where we'll talk about the things you can do to prevent complications from diabetes. Thank you again for listening. Again, don't forget to like, share, and subscribe. Until next time, I am Dr. Lum.